I'm Dion here at Icare, and typically in my day, I start off with a prayer and get to planning my day. The biggest things that I have to do each day is to see what patients require visits, and for visits I mean planned visits, which are for care. Introductory visits where I go introducing Icare because they called and wanted to know more about us. So I go in and have a conversation with either a patient or a patient and their family or whoever it is that requires our services. And then there are those visits where I go to do supervisory, which means I'm supervising a nurse, an LPN or an RN, and or I'm supervising an aide, a home health aide, a PCA, which is a personal care attendant, or a CNA, who is a certified nursing assistant. Those are my three categories in each skilled and unskilled services. There are the supervisory visits, which are to see how the nurse is doing in the home for the skilled services, and the unskilled services where a CNA, a PCT, or a home health aide is supervised. It may not be necessarily while they're doing care. It's a conversation between the family that is receiving the care or the patient that is receiving the care. And right off of that, I want to put it out there, we're always hiring for skilled nurses. So RNs and LPNs who know their worth, come work with me. You will love to work with me, I promise you. And for CNAs, HHAs, PCTs, PCAs, come on over too, because I always have something brewing. I would love to work with each and every one of you. For an introductory visit, I go into a family's home to discuss what they're looking for and what our services are. Depends on what they tell me is what I offer them. Really, it is nothing different from what a doctor will do when he goes to the office. In this case, it's just reversed. So I go into the patient's home and have a conversation, and then we get to decide whether they're ready for the service, whether the service is actually what they need, and if it is not, I can refer them to a community resource, another agency if it need be, because I really would love to have the patient just get what they need. And then if it is what I have to offer that they need, we start the process of getting them on board. And with that comes the care providers that will be coming into the home. We do a meet and greet when it is agreed that services can start and we have gotten authorization from the insurance. Then we set up an appointment to have a caregiver come in. If it is a skilled need, then it's a nurse who is either an RN or an LPN that is coming in to meet the family and make sure that the family is able to gel with the patient, with the nurse. Sometimes the nurse will walk in there and the family says, absolutely not. And that's okay. If it is the opposite, which is always what we aim for, because I try to tailor my patient's vibe to the nurse's vibe, so that if the patient is upbeat, I need a nurse who is on it. If the patient is laid back, I can't take a hyper nurse there. It has to be a nurse that is laid back and relaxed and able to flow with the patient. So that is what happens. If it's a caregiver that is needed, we facilitate that as well. All of these come together to provide the kind of nurse and patient relationship that will flourish and that will help bring the patient back to baseline if that is possible. At Icare, our aim is to make sure that the patient is satisfied, the family is satisfied, and also the nurse or the care provider is content with the work that they have to do. And I cannot wait to work with all the nurses that know their worth and know that they know what they're doing. I can't wait to work with all the caregivers that are able to express themselves and receive support from me in carrying out their duties. I look forward to working with you, and I look forward to taking care of your family. Take care.